facial appearance changes over time. It's a natural process, but one that concerns many of us.
Definitely wanting to slow the ageing process down. Who wouldn't?
I think I look older than my age. I look in the mirror and the person that I see in the mirror is not the person I feel.
I think I look my age.
I think if I had to say I looked anything slightly older.
I'd like to look 10 years younger.
I'd like to look maybe 5 or 6 years younger.
Just a few years younger would be, yes, back in the 30s would be nice.
Well, I'm 48, so I would like to look, I suppose, as long, realistically, as young as I feel. So, late 30s, be fine with me.
We look at the overall appearance when we see the effects of ageing, but there is so much more going on. Essentially, our facial appearance is made up of layers: the skin, volume within the skin, muscle and bone. The skin is affected by skin cell renewal slowing, a decrease in natural support substances, and a decline in the ability to retain moisture. Not to mention external factors such as sun damage accelerating the process. Volume, made up of naturally occurring complex sugars and fat, give the skin its round contours. As we age, volume decreases, and the effects of gravity become apparent. The next layer influencing facial appearance changes are the muscles, which decrease in strength over time, reducing support to the soft tissue above. Muscles cause wrinkles during expression. Over time, these become more noticeable. And of course, the bone foundation. Even the best bone structure can diminish over time, and the look of fullness and balance can alter. Everybody is different. Talk to your clinician about what concerns you.
What do I see? I see stress. I see a lot of grey hairs and some very quickly forming wrinkles around my eyes and my forehead through I guess, a lot of tension.
I think I have a fairly hollow face that can tend to, in photographs especially, that can tend to look a bit drawn.
Yeah, just something to enhance my cheekbones and make me feel a bit better about myself.
The bags under the eyes seem to not go away even after 10 hours sleep.
I think probably what ages me most is around my eyes and probably my forehead and between my eyebrows, really, this sort of area.
What ages me most, I feel, is that my cheeks, probably up my lips are a bit thin.
What bothers me about the way I look is, I suppose, that the lines keep getting a little bit deeper and a little bit more noticeable, really, yeah.
So that's a bit scary when you start to compare yourself to your mother.
I just want to look more relaxed. I want to look, I don't know, like life is good. I don't want to look tired, and which I feel that I do look really tired.
Sun exposure is believed to cause 80% of skin changes attributed to the ageing process, as well as skin disorders. All prevention begins here. Cosmeceuticals can increase skin exfoliation, plus retinol, antioxidants and vitamin C can decrease uneven pigmentation and promote the skin's ability to hold moisture. Over time, the natural exfoliating process, where new cells replace old ones, slows down. Chemical peels use solutions of one or more exfoliating agents to remove the rough upper layer and stimulate the rejuvenation of new skin cells. Microdermabrasion is the spraying of fine crystal particles to exfoliate. It temporarily improves uneven pigmentation, fine lines, and skin texture irregularities. Different types of lasers can also be used for wrinkle reduction, hair removal, scar smoothing, and treating skin discoloration. Intense pulsed light uses varying wavelengths or colours to improve facial appearance for a number of conditions, from the appearance of broken facial veins to freckles or wrinkles. Dermal skin fillers are made from naturally occurring complex sugar called hyaluronic acid. Hyaluronic acid is naturally found in the tissues, assisting in skin hydration by attracting and holding water. Combining with collagen and elastin, it helps provide skin structure and elasticity. Dermal fillers can diminish the appearance of folds and wrinkles, enhance and restore structure and volume to the lips and the contours of the face. Therapeutic injectable treatments have been used for over 15 years to relax the facial muscles that cause expression lines. Treatment is indicated for forehead lines, frown lines, and crow's feet, and can last up to 4 months. As we age, these lines, called dynamic wrinkles, become more prominent, and the skin is less likely to bounce back after expression. These signs of aging we notice in the upper face are generally a result of muscle contraction, weakening of the ligaments, and loss of fullness in soft tissue. These signs tend to be vertical and horizontal wrinkles. Wrinkles around the eyes when we smile, the lines between our eyebrows when we frown, and the height of eyebrows reduces, and a hooded look to our eye area can be seen. These can be treated by muscle relaxants and dermal fillers. The synergy between eyes, nose, lips and cheeks can be affected in the mid-face. Changes in structure and volume loss cause the development of nasolabial folds, tear troughs, and the appearance of dark circles under the eyes. The cheeks too lose their volume and shape. Dermal fillers can be used to fill in and plump up facial wrinkles and folds that are apparent on your face at rest, creating a smoother, more refreshed appearance. Volumizing fillers enhance and restore volume in areas such as the mid-face and cheekbone area. The lower face is mainly affected in our 40s and 50s. Loss of volume and loosening of ligaments cause soft tissue accumulation in the form of jowls near the jaw and chin. A combination of dermal fillers and volumizing fillers can treat these areas of the face. Lips are particularly affected by the reduction in volume as a result of aging. And of course, many people simply aren't blessed with full lips. Dermal fillers can be used to enhance or rejuvenate both the body and border of the lips, thus reducing the lip lines that affect the application of lipstick.
I would like people to say about my look is that, you just look fresh.
I would love people to say after my treatment that I look fresher and younger and healthier and better. Not necessarily that I don't want to look different. I don't want it to look obvious that I've had treatment. I just want to look better.
I would like people to say I look $1 million. But I don't want to look, as I say, overdone. I just want to look the best I possibly can.
I think for me the focus is really the finished look, and as long as that's natural, that's all we're going for.
I think the most important thing is that you still look yourself and still look natural.
I'd love to hear that I've just been on holiday and I'm looking really rested and well.
But just a natural, subtle look is nice.
Maybe turning 40, I'll look, fantastic.
Your clinician will know which combination of treatments will be suitable for you. In your 20s, there are treatments possible for enhancement. In your 30s, the first signs of aging increasingly appear and can be treated. The 40s is when rejuvenation to the upper, mid and lower face work in combination, as the layers of the face, skin, volume and muscle are affected by the aging process. Treatments ranging from laser and IPL to dermal fillers, volumizing fillers and muscle relaxants can make a difference. So from skin texture itself to forehead and frown lines, crow's feet, tear troughs and cheeks, to the lips and lower face folds and wrinkles. All can be treated by your clinician. Then into your 50s and 60s, although facial appearance changes become far more noticeable, continued treatments and maintenance can produce results that reduce the effects of time.